questions. The first is pretty straightforward. It's only one question. How many aged care residents died of COVID-19 by state per month since March 2020? And how many died in aged care within 4 weeks of receiving a COVID-19 injection?
Senator, I don't think we could provide that information other than on notice.
Yes, I'm happy for that.
We can certainly provide that on notice. That sort of level of detail wouldn't be available to officials today.
So data by state per month on the deaths due to COVID and the deaths due to within 4 weeks of receiving COVID-19 vaccination.
The second part of the question about the relationship to vaccinations, I think that the work that Professor Kelly's leading, that may shed some light on that question, and might be harder to get than the other. But we can get the other one. I think we can get the other one quite simply.
Well, I would have thought
the second one might take a bit longer.
Senator Roberts, can I ask a question maybe through you? For your COVID death rate, what the death rate is, for example, someone who's had cancer or been in palliative care but also had COVID, did they die of COVID or did they die of the cancer that they'd had or something? So when you get those figures, can we actually have a look? Because I know a lot of COVID deaths were put down. They died of COVID as opposed to with COVID, but other factors were involved.
So I think, Senator, as we said at the last estimates, the Victorian Health Department did some detailed analysis on their aged care deaths, and they found that 44% of people who died with COVID had died primarily from another cause, such as cancer or severe dementia. And we always report them as COVID deaths because we want to be absolutely inclusive, but it's not in many of these vaccinated people or people who've had another condition, the COVID is incidental to the cause of death.
Thank you, Senator.
coming back, Mr. Lai, before I move on to the next question, I would have thought it would be fairly simple, given the aged care records, to know whether or not a person died within 4 weeks of getting it as a COVID injection.
Look, Senator, I think I'm outside of my area of competence, but I think to save other officials coming up, I think the complexity is one, working with the states and territories around settled death data, which takes some time, and then I think there's the additional linkage to the system, Dr. Murphy, that covers immunisation.
Yes, we certainly can link to the immunisation record, and that data analysis can be done. And as you know, Senator, the TGA also does get reports of deaths reasonably close to vaccination. Many of those are considered completely coincidental and not related to the vaccination. So we can explore what we can do by data linkage to see if we can come up with an answer.
Yeah, I'd be surprised if you couldn't tell me if someone died within 4 weeks of getting their injection. But anyway, we'll see what happens.
When 1,000 people per week in aged care die, and in a busy immunisation program, there will definitely be some who die within a month of their injection, just as a matter of...
Oh, I accept that. Yeah. But we'll see if there's any trend.
Senator Roberts, we've got a break at 11, so you need to conclude by then, so I'll just give you that heads up.
Thank you, Chair. Moving on to the second set of questions. 1 in 3 nursing homes continue to spend less than $10 a day per resident on food, despite being given an extra $10 a day by the Morrison government. How are you checking whether the cash that the government gave providers is being used for its intended purposes?
So, Senator, I might hand over to Ms Laffin and to the Quality and Safety Commissioner as well on this. I mean, the short answer is that we have required people to report to us on nutrition based on that uplift in funding, and those people who hadn't given us assurance that they would report to us, their additional funding has been stopped. And then we have a process by which people who haven't met the standard are referred to the Quality and Safety Commissioner. I'll let Ms Laffin give you a complete answer, and then I think I think the Commissioner's here. She could give you more detail again.
Amy Laffin, First Assistant Secretary of the Quality and Assurance Division. So as Mr Lai said, first we require providers to provide an undertaking that they will use the money with a focus on food and nutrition. And then we require quarterly reporting on matters of food and nutrition. We've recently released the data from the first 2 quarters. What we found is that 75% of providers reported on-site only spending on food and ingredients with an average spend of $12.25 in the July quarter, and $12.44 per resident per day in the quarter starting in October. Those providers that spent less than $10 per day were referred to the Aged Care Quality and Safety Commission. And Ms Anderson may be able to tell you what she's been doing with that information.
Janet Anderson, Aged Care Quality and Safety Commissioner. Senator, we received a list of 883 services referred from the department, which had reported less than $10 expenditure a day on a calculated basis. We looked closely at that list, and then we added some services to it on the basis of our analysis of risk. We added to it services who appeared to use only pre-prepared food, and then added a further number who used a combination of fresh and pre-prepared food where they had a relatively low expenditure on food and associated labour. And so we looked at a list of 955 services, so a larger list than came across from the department. And we looked at we made an assessment of their food and nutrition profiles. Now, the way we looked at that was in the way we assess risk generally, looking at a number of different parameters. We looked at their relative ranking in relation to the quality indicator for unplanned weight loss and the top percentile of concern there. We looked at the relative number of complaints that we had received about that service in relation to food and nutrition, and rated those low, medium, high. And we also looked at any findings of non-compliance that we had made about those services in relation to the standard in the requirement in the aged care quality standards, specifically relating to food, for 3F, where meals are provided, they are varied and of suitable quality and quantity. And on the basis of the analysis of the 905, 4.5% of those services were rated as high risk for non-compliance with the expectations in relation to food and nutrition. Another 41.3% were rated at medium risk, and the balance were rated at low risk, or they had not yet submitted their quality indicator data, which meant that we weren't able to do a full risk profiling. So we then looked to the high and medium rated risk services, and those services we've rated as high risk profile will be prioritised in our monitoring schedule in terms of their compliance with specifically with that requirement in the quality standards. And I won't go into more detail about that because if we are to undertake a visit, our visits are unannounced. But I can say that there will be a greater intensity in the monitoring that we undertake of those services. And then services which have been rated as high or medium risk will be required to participate in an education program that we're currently putting together, which will give them more information and be clearer in the expectations that the Australian community has of them in relation to food, nutrition and the dining experience. We'll be expecting both staff and management to participate in those educational sessions.
So would it be fair to say that they know they're being watched?
Absolutely. Yes, that would be accurate.
Okay, thank you.
Can I ask just one question, Senator Roberts? The high-risk facilities, I'm not going to ask you to name them individually, but did they tend to be major providers or smaller independent providers? Was it a mixture? Was there any sort of trend there?
I'm sorry, Senator, I really don't have access to that detail. It is an interesting question, I agree with you, but I really can't answer it today. I'm sorry, I have to take it on notice.
Next question on this, second question on this. I understand you measure quality and safety standards. Have the rates of breaches of quality and safety standards improved specifically? Can you quantify it?
No, there's been no material improvement in assessed compliance with the aged care quality standards. However, it's a complicated question to answer succinctly because we have been improving our capability as a risk-based regulator, which means that we are more able to identify the higher risk services because we are more proficient and skillful in understanding bits of intelligence that come to us. We put them together as information in a risk profile for individual services, and we understand how that profile relates to other profiles for peer organisations. And in that risk profiling exercise, we then pay greater attention to those who are rated as high risk. So our detection rate for non-compliance has actually improved because we know where to look. And so we are finding high levels of non-compliance, but we're also looking in the right places for non-compliance. So that is why I can't say categorically we are seeing overall improvements in quality and safety, because as a regulator we are becoming more efficient and effective in identifying non-compliance.
Minister, would it be possible for one of my staff to come and have a talk with the agency?
Sure, that would be fine.
Okay,
Final
last question. Last question?
Yep, last question.
Senior Australians have different needs and health issues to younger people, yet they're treated as part of a larger community segment. Why do we not have purpose-built seniors-focused healthcare facilities, including seniors' hospitals? Would that be a way of not only improving the service but saving money?
Senator, the average age of the inpatient in our major state and territory public hospitals is about 70. So effectively we do have hospitals that are looking after the elderly, because mostly, obviously, as you realise, chronic disease and disease burden increases as we get older. So, but I think your point is valid, that there are some specialist services that are very much directed towards dealing with the elderly, and we have a very strong focus in the department on enhancing and working with the states and territories to get geriatric services into aged care facilities, and there are now some very good models of in-reach where those aged care services get those specialist geriatric services and specialist mental health services. But essentially, you know, our hospitals are largely for the treatment of people of more advanced years, given that's the nature of disease. It's
a useful point you raised, because hospitals I find daunting, many people find daunting, so for an elderly person it's even more daunting. And some doctors say it's better to stay out of hospitals. They're not being derogatory, they're just saying...
you don't want to be in a hospital unless you really need to be
right,
in there.
That's
Senator.
what I'm getting
that's
at.
Absolutely right.
Senator, the budget measure, the multidisciplinary outreach measure in the budget is precisely about bringing gerontologists, some of those health experts, into residential aged care to give that access in their home setting, rather than, because we see where people have a more complex set of health circumstances, that what we don't want is the residential aged care facility just quickly admitting them to hospital all the time and having that experience, if that could be delivered in the residential facility.
Thank you. Who do we contact, Secretary, for the previous question? The data.
Well, I think if we to get a briefing request to go to Minister Colbeck's office. Yeah.
Thank you.
All right,
Thank you, Chair.
Thank you very much.